everyone, Dr. Idaluca here. I'm at West 26th Street in one of our offices, and I wanted to talk about what happens when you get an adjustment. What does the chiropractic adjustment do for the spine? And the staff, frankly, when they give people a tour, they'll point over here and they say, this is where the magic happens, because people still don't understand exactly what happens when we adjust you, but I'll show you what's happening with the magician behind the curtain, okay? When we're adjusting your joints, most oftentimes they're fixated or locked up or stuck. Most people think the joint is in the wrong position and then we shove it back in the position it's supposed to go in. And in one adjustment, we realign everything and then let's take a new posture analysis and see how you look. It doesn't happen that way so much. Over a series of adjustments, many adjustments, we can see some postural changes and some changes with the joints. But the most common thing that we see is the joints are fixated, they're locked up. You feel old, the joints get arthritic, they get gummed up, locked up. I've heard many different ways people describe this. But when we adjust you, we get the joints in your back freed up so they can move the way you're supposed to. Do you ever see how like an 8-year-old will stand there and just do a back bend, and you look at their spine while they're bent all the way backwards, and you say, well, I've never seen anyone 85 do that, or very, very rare. What's the difference? And so it's keeping the joints moving and keeping the pliability, keeping the elasticity, keeping the joints young. And so we're cheating, okay? So when you go into the chiropractor, just like going to the dentist, you don't have to go to the dentist. Your teeth will just rot out at a younger age, right? And so when you go to the chiropractor, we just keep your joints and your back from rotting out at a younger age. So chiropractic works awesome. We get the joints moving in your back and it frees them up and allows you to cheat some of that old age, okay? And so when we adjust the joints, we'll get them moving the way they're supposed to. Now, certain joints in the back are more susceptible to problems. Like, for example, the last two joints before they sit on your pelvis, we almost always adjust that area because all of your body is stacked up on top of this joint, okay? L5S1, where the sacrum is. And so it absorbs all of the force, okay? And there's certain joints in your neck that get fixated and locked up more than others as well. And so the chiropractors are trained to find these joint fixations or subluxations, and we'll get the joint moving the way it's supposed to. We use whatever the lightest technique possible is for the patient. And so if grandma comes in and she's 112 years old, we're gonna adjust her much differently than if McDowell's football fullback comes in. Okay, he gets a totally different adjustment than grandma. Why is that? It's the same reason when we go to the gym with the two, they're on different programs, because she has a different spine than our 17-year-old, 225-pound fullback, okay? And so the chiropractic technique is tailored to the individual. So a little bit about how our chiropractic technique works here. I'm over at our West 26th Street office, and this is one of our brand new Ferrari tables here. It's made by Chattanooga. Thanks so much.